Throughout the morning, we already learned a little bit about what is Erdheim-Chester disease in general, histiocytosis, some of the treatments. But one of the things that we have encountered is that Erdheim-Chester disease in itself has a variable age of onset, a variable way of presenting in affected people individually, and that the clinical spectrum is an evolving landscape. We're learning more about this disease as we diagnose and follow more patients. So what are these manifestations? What does it mean to have Erdheim-Chester disease when it comes to organs affected, and why are we so different when we are manifesting this? So for that, Dr. Jerome Razanamahery from Dijon University Hospital in Dijon, France, is going to give us a talk about ECD's clinical manifestations. He's an ECD Care Center Lead physician with vast experience in this condition. So thank you for joining us today.
So thank you for the kind introduction. I'm Dr. Razanamahery from France, and I will try to tell you about the clinical manifestation that the patient with ECD can have. So this is the focus of the session. The goal is to understand which organ can be affected by ECD, and how likely each one can be affected. Learn how the physician determine if organ is affected. For the patient, it's really important to know what symptom to watch for, and of course the goal is for you to feel more confident about your disease, about discussing the concern with your care team. So as the other have mentioned earlier, ECD is a rare blood cancer. We can consider it as a smoldering cancer because it's not aggressive like other type of cancer, lymphoma, and stuff like that. We know it's affecting mostly adults, and as we talked about earlier, there is some mutation in the MAP kinase pathway affecting resident cell, and those cells proliferate, and the proliferation can lead to organ dysfunction. So based on that work made by Francesco with the registry, there is more than 1,000 patients, and if you look at the distribution of the disease sites, you can see that it's affecting a lot of organs. As Gaurav said, you have a median organ involvement of 6 organs, and the most common one is the bone. Then you can have retroperitoneal involvement. Some patients have vascular involvement with aortic lesion. The disease can affect the CNS, the orbital or sinus, the heart, and other one. But the most frequent are the bone lesions. But with that work, you can see here the most common reported symptom by the patient at the diagnosis of ECD. So for most of the patient is bone pain. Some patients can have symptom related to retroperitoneal or renal abnormality, related to diabetes insipidus, some CNS involvement, and some patients may suffer from skin involvement. But the most important thing of that slide is that you can have non-symptomatic involvement, and it's not because there is a lesion on your CT scan or PET-CT that you have symptoms related to that. So that's really important, I think, for the patient. So this is what you can see on the PET-CT. You see the long bone involvement, in particular here, and it can cause bone pain for the patient. Here you can have what Julien said, pericardial infusion, which is causing some chest pain, and some patient may have tumor, which can cause some syncope or malaise. So it's really important for the physician to make the diagnosis for this patient, because you have to refer the patient to a cardiologist really early. Some patients can also have retroperitoneal involvement. This is what you have on the CT, on the PET-CT. You see the kidney, and there is like fibrosis around the kidney. So it can cause some pain, some difficulty for the urination, and some like that. And of course, some patients can have CNS involvement. So this is what you see, what you can see on the MRI. Mostly it causes some vertigo, some gait disturbance, and it can be important to have the diagnosis at the beginning of the disease. So the other symptom that patient can have, it's related to diabetes insipidus, because the patient is going to pee a lot, and because of that, he's going to be thirsty. He's going to drink like, I don't know, like 5 liters of water, and it can be a sign of endocrine involvement. So you have to be really careful about that during the journey of the ECD. And most of the patients have like a brain fog. I think for the patient, the most important symptom is fatigue, because they say they are not like they were before the disease, and they all have brain fog, but sometimes you don't see anything on the MRI. So this is really important, the low energy level. It can be caused by the disease itself, or because of the treatment. It's really important to report that symptom. And of course, some patients can have fever related to inflammation. So how the physician know which organ are affected? Every time that you come at the appointment, you've got a physical exam. So of course, you can look at the obvious thing like the skin, the leg swelling, and stuff like that. And usually, we make a complete blood test with the blood smear. We look for the inflammatory marker. We can be a sign of non-controlled disease. We look at the kidney and the liver function. We make the hormonal testing, and we look for associated condition, because some patients with ECD can have other issues like autoimmune disease or myeloid neoplasm. It's really important to make the diagnosis, because it can change the treatment strategy. And of course, we've got the imaging. Most of the patients at diagnosis had a PET CT, and during the follow-up to see the radio tracer, there is no uptake on the PET CT, but it doesn't mean if you have an uptake on the PET CT, it doesn't mean that the disease is active. Because some patients may have an uptake on the bone, but it's not because you have an uptake on the bone and there is nothing else that you will change the therapeutic strategy. So it's really important to know that the decision for treatment is not only based on PET CT. Or usually the patient get brain MRI at the diagnosis, and sometimes we do it if patients develop a balance issue during the follow-up. But if there is no problem, we don't make brain MRI like at every consultation, and most of the patients must have cardiac evaluation at least at the diagnosis to see if there is no pseudotumor in the atrium, which is related, associated to BRAF V600E mutation, but we don't do cardiac MRI every time. But the most important imaging for us is the PET CT, but the other one can be valuable, especially brain MRI when there is some gait disturbance or stuff like that. So what should someone with ECD expect? So many of the patients live with ECD. They live well with the right care. The most important stuff is to find the good treatment to like downstream the activity of the disease, and there is no side effect. But this is the most important part of what we do, and of course the patients do well with the right treatment. Some organ may never be involved during the course of the disease. As you saw, all the trials, so there is new treatments that are coming, and the new treatment, the target therapy, have really improved the outcomes for the patient, and of course, monitoring is the key. So every patient can have fatigue, but we have to try to deal with the fatigue with non-pharmacological intervention, especially exercise, cognitive behavior therapy, mindfulness-based program, and Tai Chi, because it can really improve the quality of life of the patient, because it's not because that we give you one target therapy that you will not feel fatigue. So we have to try other stuff to deal with the fatigue. Of course, we look for hormonal tests to see if there is no abnormality, but I think it's really important to try to fight the fatigue with non-pharmacological intervention. So what symptoms should be reported? I think shortness of breath, chest pain, or leg swelling are important, because it can be because of heart involvement, so it's really important to report that kind of symptom. I think flank pain, decreased urination, or increased level of fatigue can be related to kidney involvement. Of course, you have to report the persistent bone pain, and mood, vertigo, and really low energy level we can be due to neurological involvement. But of course, no symptom is too small to mention. So this is what you can do, like symptom tracker. So you can have this to prepare the consultation with your physician. You note the symptom, the duration, the intensity, to see if it's related to ECD or maybe side effect or other stuff, because some patient can have other condition. So I think it's important for the patient to report the symptom and stay proactive, because in a consultation of, I don't know, 20 or 30 minutes, we don't know which symptom can be related to ECD or other stuff. And if you had that tracker like before the consultation, if you send it to your physician, I don't know, 1 week before the consultation, it can be really helpful for us to help you to manage the symptom. The final message, every ECD journey is unique. It's really important to stay engaged and, of course, report your symptom. Stay proactive with activity, exercise to deal with the fatigue, and the medical team is here to help you. So with all that we have, I think there is some hope with the treatment, with the knowledge of the disease, and with the collaboration of all the physicians all around the world. So this is a picture of last year meeting. So of course we're here to help you, and the ECDG is here to help you. Thank you. Thank you.